Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, 5 deaths recorded in 2 states as country records more COVID-19 cases. Total samples tested put at 171,931. Special Committee for Research on Coronavirus and Other Infectious Diseases in Plateau State make headway towards finding cure to the virus. And travelers to the United Kingdom from 59 countries no longer required to self-isolate for 2 weeks. The global numbers of coronavirus cases now stands above 12 million, with countries like the US, Brazil, India and Russia having over 700,000 confirmed cases. In Nigeria, the Center for Disease Control (NCDC) recorded 5 deaths and 499 new cases of COVID-19 in 24 hours. According to the latest figures released by the NCDC, the total confirmed cases stand at 30,748, while 12,546 have been discharged across the country. 17,513 are active cases still undergoing treatment. The 499 new cases were recorded in 23 states and the Federal Capital Territory. Lagos, the FCT, Oyo, Edo, Delta, Kano, Rivers, and Ogun State are the 8 states with over 1,000 confirmed cases in Nigeria, but they have also discharged the highest numbers in the country. To reflect the current economic realities caused by the outbreak of the coronavirus pandemic in Nigeria, President Muhammadu Buhari has signed into law the revised budget 2020 following the passage of the bill by the National Assembly. The revised budget of 10.8 trillion naira had initially been passed by the Assembly and sent to the President. According to President Buhari, ministries, departments and agencies will be given 50% of their amended capital allocation by the end of the month of July. Now, the Special Committee for Research on Coronavirus and Other Infectious Diseases in Plateau State says it is making headway towards finding a cure to the virus. Chairman of the committee, Professor Noel Wanang, told Channels Television at the laboratory in Jos, where the research team has been exploring various ways in searching, designing treatment protocols for the cure of the virus, that they are now at the final level of human clinical trial. The special committee was inaugurated by Governor Simon Lalong in May with the mandate to search for conventional and alternative drugs for the treatment and cure of the disease. The committee comprises experts in various medical endeavors, Professor of Pharmacology and Toxicology, the Secretary General of West African Postgraduate College of Pharmacists as the lead researcher, and others.
We have reached a stage that we need ethical clearance to go into human treatment, and we have applied. We have been given clearance by some institutions, so we are going to commence the protocol in humans very, very soon. In fact, with side by side, we are still doing a lot of other work. You know, research is endless. As you are doing this direction, you now realize that you can also add up and do 1 or 2 things. The more the information, the better. We are still doing a lot of those things side by side. But at any moment, we have reached the stage that we are ready with our products. Our products can go into human trials. Our products can go into drug treatment trials. And I want to assure people, the citizens of Plateau State and the world at large, by and large, give us some short moments. As scientists, we're not rushing to making any pronouncement if we are not sure of what we are doing. By the time we are done with the human treatment trials, we are ready to present our results to any place. We are ready to make our declarations, and we are ready to participate in any conference. where we can now discuss our results and then we sit down and understand ourselves, science for science.
The Nasarawa State Governor Abdullahi Sule is promising health workers in the state of adequate provision of safety items as they spearhead the fight against the disease in Nasarawa. The governor made the promise when he hosted resident doctors from the Federal Medical Center, KEFI, at the Government House in Lafayette.
There was nothing wrong with having misunderstanding with your employer. But I will urge you to please always consider the innocent people when we are getting into this kind of thing. Let's not allow this kind of situations to degenerate to the level of going on strike. I strongly believe that most of these issues, if we sit and discuss much earlier, we shall be able to resolve them rather than resorting go on strike, especially at a very difficult time like this. One of the areas of agreement with the medical staff was on the provision of PPEs. And locally for us, we have lots of PPEs right now that we can provide to ensure that people, doctors and other medical staff are not exposed to the danger of coronavirus.
The Delta State government says it will take stringent measures to ensure full compliance with prescribed protocols for averting the spread of COVID-19 in the state. A member of the state's task force on COVID-19, Mr. Michael Nwoko, attributes the recent spike in the number of cases to increased and improved testing, asking people to take responsibility.
We're looking at increased or enhanced testing capacity, which is what is currently on the ground in Delta State right now. We are now getting to the phase of community testing, wherein a lot of persons will be granted access to testing. And you know that when that comes to the fore, obviously you are going to see more cases, etc. Okay? Then the second has to do with the people's adherence to preventive protocols, and of course the third has to do with effective contact surveillance and of course management. Contact surveillance includes tracing persons of interest, the POIs, okay? So as to be able to subject them to testing, and so those who are confirmed positive, strategy is adopted in order to take them to either treatment facility if they present severe symptom, or begin home care if they present a mild symptom, etc. Then we're equally looking at the incident and case management, as it were.
Now, following the ease of lockdown on interstate travel, some car parks resumed daily operations, trying to adhere strictly to the COVID-19 protocols as directed by health authorities. Some of them spoke to our correspondent.
We are ready to comply, say 100%, because all the passengers, all the guests in the vehicles, they wear their face masks and nose masks. They wash their hands with soap and sanitizers. And we're also checking with the temperature meter. So since we've started, it has been very, very okay. And I hope and I pray with this complying policy, things are going to get better.
The awareness is beginning to get high in the society. The awareness is high. People are beginning to understand that I think this is real, that we should be able to do this thing to curtail the spread. So I just urge everybody to continue doing what they are doing in order to curtail the spread of COVID-19.
The Presidential Task Force on COVID-19 was inaugurated by the President to work with relevant government institutions to mitigate the impact of the virus in the country. Certain state governments and their ministries of health are expected to lead the response at their various states. Kaduna is one of the top 10 states with the highest cases of COVID-19 in Nigeria, but it has discharged 601 patients and 294 of them are currently being managed at the state's isolation centers. Well, for more on the state, the Commissioner of Health, Kaduna State, Dr. Amin Abaloni, joins us on the program via Skype. I'd like to thank you for joining us at this time and begin by asking how the state is responding to the coronavirus pandemic in terms of reducing the spread.
Thank you very much for having me. Kaduna State is employing a number of strategies, as has been done by others, to contain the rising cases of COVID-19. Recall that one of the measures was to institute a lockdown through the quarantine order, which the state just started relaxing by on the 6th of June. Part of it is in response to looking at our cases at that time and also the other parameters. We've continued aggressive risk communication, talking to the public. We've engaged at the grassroots, talking to all stakeholders to make them understand the impact of COVID and their role in it. We've rolled out the Forward campaign, which is a campaign that emphasizes personal responsibility in compliance with all the regulations that have been put. We've increased our treatment facilities. Currently, we have 5 centers. The Infectious Disease Control Center. We have a center in ABUTH. In the Kafanchan General Hospital, we have a center, and total of 273 beds. And about 10% of our patients are being managed on home care in accordance with the NCDC guidelines. We've increased testing. We have currently 4 labs, one of which is a mobile lab, which goes from community to community to do some community testing. And that has greatly increased our testing capacity. In the last month, we've tested more than 5,000 samples. And this is partly to explain our rise in cases. We're testing more. We're going to areas where we consider silent and finding out if we do have the burden of disease there. So these are some of the strategies we're employing. We also have a strong coordinating mechanism, which is multi-sectoral. The technical response is led by the Emergency Operations Committee, while the state response is led by the COVID-19 task force. So all these are part of the strategies we're employing to see that we reduce numbers to the barest minimum.
All right, Dr. Baloni, has Kaduna State reached its peak? We have some states like Edo State projecting when they will get to their peak and indeed when they will see a flattening of the curve.
I believe we haven't reached our peak yet. We're still making our projections. Increasing the testing is helping us to see exactly the spread of the disease, also to help us to put in containment measures. So we anticipate that we're still not reached our peak, but we can see some light at the end of the tunnel. The increases we're getting are not as high as in the last week as we've been getting the previous week. So we're hopeful that we're beginning to get ahead of that curve.
We appreciate your time. The Commissioner of Health, Kaduna State, Dr. Amina Baloni, thank you for sharing your thoughts. Thank you for the updates from the state.
Thank you very much.
We have more on the COVID-19 updates when we return. Please stay with us. Car makers contribute significantly to the German economy. Almost 1 million well-paid jobs depend on this sector, half of them in the prosperous south of Germany. With the economic downturn a challenge to thousands of jobs, income and tax revenues along the full supply chain, there appears to be a warning that the auto industry faces big challenges, especially at this period of a pandemic. DW correspondent Janelle de Marlon joins us from Berlin. Hello, Janelle.
Hello, good afternoon.
All right, glad to have you. How about our things at the auto industry? We're hearing that many car makers cannot use their full capacities due to international supply chains being disrupted or even public health restrictions, which still apply to some factories.
Indeed, the coronavirus pandemic has created ripples all around the auto industry and into its supply chain, and the effects of those are going to be felt for a really long time. In the year of 2020, however, European car sales are projected to fall 25%. That's going to be its worst showing since 2013, towards the tail end of the financial crisis. But it is important to note that the coronavirus pandemic is just the latest in a set of disruptive challenges that have beset the German auto industry. Chief of them, the very expensive transition to electromobility from traditional combustion engines. Now, this is an area where the German auto industry has really had to play catch up, and it was in the middle of trying to do that with painful restructuring and cost-saving programs and potentially retraining its workers. And then the coronavirus pandemic happened, and that has the potential to disrupt this big overhaul, thus making the challenge of future-proofing Germany's auto industry all the more challenging.
So following the lockdown measures, we know that many car dealers had to close for many weeks. You've also talked about a few of the challenges, but how much impact did it have on unemployment or income cut?
Well, we've now arrived at a stage where the car dealerships were allowed to reopen in April, and many of the big car manufacturers restarted operations, albeit with social distancing restrictions in May. But really, what the industry is trying to do now is get its many workers out of Kurzarbeit. Now, Kurzarbeit, that literally translates to short work, and this is a mechanism that is often employed in crises times where workers accept fewer hours and a lower pay, and the state sort of steps in and covers the lost income. Now, over 50% of car industry workers entered this Kurzarbeit scheme, and the industry is now trying to get them back. But even if it does, and it gets everyone working to full capacity, there's no guarantee that they will be able to sustainably hold on to those jobs. Even before the coronavirus pandemic, the big car manufacturers were all announcing thousands of job cuts. And because of the coronavirus pandemic, that's only set to get worse. The biggest estimate I've seen of potential job losses is somewhere around 400,000 by 2030. So that's nearly half of the active workforce in the German auto industry.
Are there any possible bailouts, and are there also fears of a resurgence of the virus, seeing as the world is opening up?
Well, Germany does have a 130 billion stimulus package that's meant to help jumpstart the economy in this age of COVID-19, and the auto industry does stand to benefit from that. For example, through the reduction of the value-added tax by 3% on all goods, and that includes cars. Buyers of e-cars, for example, can enjoy a 6,000 euro premium provided that the price of the car is below 40,000 euros, and an additional 2.5 billion is also being put towards investment in battery cell production and in infrastructure. It has to be said, however, that these measures fall short of what the auto industry had actually wanted from the state. They also wanted a scrappage scheme of finance, a cash for clunkers program where consumers bring in their old cars and get money in return. So perhaps what we're looking at is an age of an unprecedented crisis for Germany's prized industry, but also happening at a time where Germany's government is less willing to step in. As for whether there's going to be, there are fears of a resurgence of the virus. There certainly have been localized outbreaks in the last weeks, like, for example, at a meat processing plant in North Rhine-Westphalia in West Germany. Now, this is something where virologists say they hope that highlights in the public's mind the importance of maintaining hygiene and social distancing restrictions. And this is not something I think that is limited to Germany. I think there are quite widespread fears around the world of a potential
loads of optimism.
second wave.
All right, we'd like to thank you, Deutsche Welle correspondent Janelle de Malon. Thank you for joining us. Now, travelers arriving in the United Kingdom from dozens of countries no longer have to self-isolate for 2 weeks from Friday. The rules are being relaxed for arrivals from more than 60 countries and British overseas territories. Here's more on our global update.
COVID-19 cases in Latin America have exceeded 3.15 million, infecting leading politicians in several countries. The latest being Bolivia's interim president, Janine Áñez. In a video posted on Twitter, she says she felt well and strong but would remain in quarantine for 2 weeks. Ms. Inez is the second leader in South America to contract the virus after Brazil's president. Meanwhile, President Bolsonaro is calling for calm amid the pandemic and also warning the elderly and the immunocompromised individuals to protect themselves against the coronavirus. Tokyo's number of confirmed cases in a single day hits new highs with 224 new cases reported, which is the largest number since the pandemic outbreak. However, the Japanese and Tokyo metropolitan government believe that there is no need to issue an emergency declaration again. Australian travelers are happy as Queensland opened their borders to all other states and territories except Victoria. Travelers are being allowed into the state without undergoing a mandatory 2-week quarantine for the first time in 15 weeks.
And back in Nigeria, to Bayelsa State, where our correspondent Dobra Timuwood tells us how students are learning with schools shut down.
Education is one sector that has been greatly impacted by the outbreak of the coronavirus. For over 3 months, students of Bayelsa State have been at home, most without the privilege of learning online. Earlier on in the day, we spoke with the Permanent Secretary of the Ministry of Education, and he says the states will abide by the directives of the Federal Ministry of Education.
Federal government initially announced resumption of schools before 4th of August, that every school should open. So Bayelsa was equally preparing to see how we can open our schools. And the directive came with a guideline that NCDC guidelines should be followed by providing running water, washing of hands, face masks, sanitizers. All those necessary things should be provided in the schools before resumption. Yesterday, we now had a counter announcement by the Minister of Education. So if federal government say no schools should open, Bayelsa too cannot open our schools. So that is the situation. And the WAEC, the minister also went further to say that WAEC cannot dictate the resumption of schools for Nigeria. So we are also following up what the minister is saying. So we cannot open our schools for now.
The Permanent Secretary also disclosed that measures are being put in place to ensure that all schools, especially government-owned schools in Bayelsa State, are fumigated, and sanitizers provided, and face masks provided for the students when the federal government gives the nod for the reopening of schools. From Yenegua, Dobra Timuwood for COVID-19 updates.
Take responsibility to protecting your health. You can visit the NCDC website and find the latest statistics, regulations, guidelines as to the coronavirus pandemic. It keeps updating. You can see some of the numbers in real time. From the World Health Organization, your questions are answered as to the global situation of the virus. You can take a look at some of the strategies and plans to indeed the virus. Our website, channelstv.com, has the latest news. All you need to do is log on, access the news in health, politics, business. You can see all the top latest stories from Nigeria and across the world. That's the COVID-19 update. Thank you for watching. I'm Millicent Nwaka. Bye for now.